All right. So overall, can you give us a little bit, an update of what the situation looks like with regards to the tripledemic after the holidays? I think I talked to Dr. Brabson yesterday, and he had said that, there's, I guess the hospital's starting to see an uptick in COVID infections and other infections, especially because of the holidays, and it's kind of like that post-surge that a lot of health experts were worried about.
Yeah, exactly. I think like post-holiday, we're seeing a larger surge of individuals coming in. I think we're seeing exacerbations of underlying conditions, and that's been worsening with these viral illnesses. People gathered together, and they're spreading the virus, unfortunately, amongst each other with RSV, influenza, COVID. And we're seeing those underlying conditions of people maybe not watching their diet as much, taking more intake. So we're seeing heart failure and stuff get exacerbated. So they're coming into the hospital sicker, requiring more attention. And so we're seeing an uptick in admissions into the hospital.
What are some of the what's some advice that you could offer people in the public to try to, I guess, protect their health? I know especially a lot of healthcare professionals are saying unless you're really sick, don't seek out the hospital. Try to get care. It's some other form, maybe from an urgent care or a PCP, because essentially the goal is to try to keep people out of the emergency room so that the physicians can care to the people that really need it the most, essentially.
Yeah, I mean, I think, truthfully, I think seeking out your primary care, going to urgent care is just really important to try to get some of those underlying conditions under control. Some of the things that got us through the several waves of the pandemic is still really an important factor right now. Washing your hands, wearing a mask around people that you don't know, and obviously getting vaccinated. It's really important to try to optimize your health so that you can prepare yourself in case you do encounter one of the viruses. That being said, if you do start feeling sick or ill, to seek out attention right away, reaching out to your primary cares, reaching out to urgent cares, and getting appropriate medications, I think, to help curb some of the exacerbation is important.
And I think nowadays also there's a lot of good options. Virtual care is the big one. So if you are not, you're not able to get into one of the urgent cares or the primary care offices, you can always connect to the virtual care. There's a virtual list that runs 7 days a week. So there's always another option that you can seek attention, and you don't need to come to the ER where there are a lot of sick patients around. So I think that's another option too that we can use.